All right, thanks everyone for joining us. We're ready to get started on our, let me turn this down a little bit and see if I can't avoid some of that reverb. Not sure why that's happening. But anyway, thanks very much for joining us. We'll work on any technical problems while we listen to Charles McKee, who will start us off for today. Hi, Charles.
Hi, Maya. Thank you for starting the briefing off again for this week and this Friday ending of the week, Friday briefing. I, as usual, appreciate everybody's participation and helping to get the stories out that are important. We will hopefully work with you to get those stories as accurate as possible. I would like to note that I'm only going to take questions today from Earl the dog. For anybody who is interested in asking questions, they all have to go through Earl because he loves my voice, I understand. With that said, I'll talk a little bit about some of the things that I think are in the media now that are of interest and not in the media that might be coming up. So I think many people are aware that has been reported that there have been many cases in the agricultural industry, COVID-19, and Dr. Moreno will talk about this a little bit more. But as I think everyone is aware that no industry is immune, and every industry should be expecting the virus to be hitting their industry. Every geographical area, there's no geographical area that should not be expecting it. There's no age group, there's no income group that should not be expecting COVID-19. And I think that we all have to recognize that the virus is, doesn't play favorites in that way. It does actually hit certain communities harder based on some socioeconomic factors, from what I understand, and some of the health risks associated with certain communities. What I think is also important to know is that there's been a lot of attention on the county as far as preparation and plans. And we are hearing it from both sides. We hear it from the side that says, you guys are overreacting, you're crazy, this is, you're just wasting time and money and energy and scaring people. And then the other side saying, you guys aren't prepared, you have nothing in place, you're not working on this. And by seeing some of the increases in different industries shows us that we are doing the right thing by trying to set up the alternative care site at the Marina Airport, which many jurisdictions are just leaving to the state. We're stepping forward to doing it ourselves because we think we have to be prepared. By setting up alternative housing sites throughout the county, the trailers that many people know about, the motels, hotels that we've been setting up, the larger facilities at the Monterey Fairgrounds, the city of Salinas, in King City, fairgrounds down there we're looking at. So it's a multi-pronged approach, and it is to be prepared, and we hope we are over-prepared. The idea is to be over-prepared and not under-prepared. There's a lot of criticism of the county for overreacting as far as data and numbers, and I think as many people are aware, models are models. They don't necessarily say exactly what's going to happen, but they give you some tools to plan for. And while you might not have the right inputs to make that model perfect, or you should know that no model's perfect because of the inputs, we have to work on making sure that we're prepared. And we hope that that in the end, we continue to get criticized for over-preparing, because that's the idea. And then we can say that we made sure that people were safe. We also recognize that there's a lot of stress associated with these kinds of this kind of shelter-in-place order and restrictions on businesses, and that does not go unnoticed. And we are working with many business communities, with the cities, on, looking at being prepared for when there's easing of restrictions and opening up of the economy. And that coordination and collaboration is going to continue. And we are actively making sure that as many of the businesses that want to participate can, in a way that doesn't overwhelm us. We're not going to be able to have everybody at the table, but as many as we can, and trying to work through different industries and with some of their trade associations. So the pain that all this is causing people doesn't go unnoticed, and we are looking at that and trying to make sure that people can start seeing a light at the end of the tunnel to say, okay, there are plans for trying to look at reopening, and when reopening happens and easing of restrictions, that we can do it, we can be prepared for it, and we can do it orderly way, and in a way that doesn't risk a resurgence here in Monterey County in any of our industries, because that would devastate us if we had a resurgence that was worse than the original. With that said, I also think that the public should be aware that we're doing a great job as a community, trying to keep our numbers as low as possible. It's remarkable how people have reacted and have taken it seriously. You see people all over the place with masks on, with face coverings. Some are the more interesting than others, but the message has gotten out, and the shelter-in-place orders have been working. We don't want to lose that momentum, and we want to make sure that the public is aware that they're doing a great job, and it's a wonderful testament to the recognition of the community coming together. So wanted to say that I have to leave this call this Zoom fairly soon. I apologize for that, to get on another meeting call. And if Earl wants to send me his questions in writing, I'm happy to take them.
Thank you, Charles. And that would be the palm print questions, which we'll try to decipher for you. And then if Kate from the Californian would get in touch with me, I'll have Earl's press credentials prepared for him. Next, we'd like to go to Dr. Moreno for a public health update.
Hi, good morning, Mia.
Good morning.
Hi. So for today, just want to address a few things. I think Charles already touched on probably most of what I wanted to share. We do have continue to update our website with our numbers. I've asked earlier this week, I think there was a question of whether or not we had a spike in Monterey County, and I checked with my epidemiologist again, and there's no evidence of a spike in cases in Monterey County. If anything, as Charles said, the shelter-in-place order has been effective at spreading out, increasing the amount of time it takes for the virus for the confirmed cases, the number of confirmed cases to double in Monterey County. So that's still evidence of good work out there by people trying to reduce the spread of the virus. And then as far as demographics, we have 164 cases as of yesterday, still with fortunately only 4 fatalities, and we continue to update the demographics on our website. And our laboratory still is still conducting the majority of tests in Monterey County, and we're approaching a total of 3,000 tests in Monterey County. I just look at the number; it continues to grow, and that's I very much appreciate Dr. Ferguson in our public health lab and all the team and the volunteers working very hard every day to conduct testing, and we hope that we will continue to see increased numbers of tests as our hospitals continue to receive shipments of reagents from their vendors and from the California Department of Public Health to increase the availability of testing and increase the number of people tested, so we can have more data to guide our decision making. I think Charles already talked about the efforts to in Monterey County under the Emergency Operations Center. I don't know if anyone from EOC is on, so I'll hold off on that. I'll just add that we have we're getting close to 1,000 close contacts that we've identified. These are people who are, we believe, were exposed to a confirmed case of COVID-19, and our team of investigators continues to expand as we reassign and train more folks from public health to participate in the contact investigations. And we most certainly will be exceeding 1,000 contacts total since we started disease investigation pretty soon. But we'll continue to do that because that's our main way of, one main tool we have in public health to contain the spread of the virus. And I am still working on finalizing orders to require individuals in the general population and to cover their face when in certain circumstances when they're in public. So still working on that as well. So I can take questions anytime, Maya.
All right, thanks very much, Dr. Rito.
Next on our list today is staff from RMA Public Works. And I apologize for the reverb here. I can't seem to get rid of it. I'd like to welcome Lindsay Larrable and Randy Ishii from our RMA Public Works.
Talk about what's going on there. Lindsay, go ahead, but unmute. Lindsay, can you unmute?
Sorry about that.
No problem.
Okay, thank you. I'll go ahead. RMA facilities, we have a couple different departments within our team. We have a maintenance crew that provides services like janitorial, public security, preventative, and unscheduled repairs, such as electrical, mechanical, and plumbing. We also have a grounds team that manages weed abatement, fuel management, trash removal. So we also do keep our grounds maintained. Through this process, we have looked at how we are scaling back services just to ensure just critical preventative and unscheduled repairs, practicing social distancing with our team and appropriate PPE. We also have project managers. They are part of the team that manage the capital projects, the design work, plans and specifications, the construction projects, the actual building, and then emergency repairs. So a couple of our key projects, capital projects that have been deemed essential projects for the safety of our community and occupants. It would be the new juvenile hall project at 1420 Natividad. We also have the jail housing addition project that's at 1410. I'm sorry, the juvenile hall is 1420. Jail housing is at 1410 Natividad. We're also kind of moving forward with the emergency shelter at 855 East Laurel, and this is the new 16,000 square foot project or building that will provide 100 beds for members of our community. We're continuing to move forward with critical infrastructure, repairs that would be critical for the safety and health of our buildings and occupants. This would be boiler, chiller, HVAC repairs that are critical to maintaining operations within our buildings. We're also moving forward on IT site readiness. We have one going on at 911 call center and the upper and lower Toro. These are seismic retrofits to ensure we are prepared to maintain critical communications. In the design phase, we have the East Salinas Behavioral Health Clinic. This is a new 18,000 square foot building to provide services to our East Salinas residents. And this is currently in the permit stage and will be, when we're working currently to get go out for RFP at the end of this year. And while projects like painting, carpeting, tenant improvements are things that we'll continue to schedule and plan for, we are going to wait until we are to go back to business as usual to maintain or to move forward with construction on these projects. So thank you. I'll turn it over to Randy Ishii, our RMA Public Works, Chief of Public Works.
Go ahead, Randy. Randy, are you able to unmute your phone? You know, I don't think we're able to get him right now, so let's move on, and then we'll get back to him if we can bring him on the line. Next, we've got some presentations from our economic division to talk about the small business emergency loan update, and there's some good news with that. So first, we'll start with Darby Marshall.
For some reason, I can't
get Darby either. So perhaps we can go to Lori Van Pepper from Cal Coastal. Are you on the line, Lori?
Can you hear me now?
I sure can. Thanks, Darby.
Okay. All right, and can you see my screen?
Yes, go ahead. Great.
Okay. So Monterey County established its small business loan program about 40 years ago. The Board of Supervisors started it with a small local investment and federal grant funding. Last Tuesday, the board modified the program so that we were a little more responsive to the current business needs. We are now doing loans of up to $25,000 with a 5-year term, 2.45% interest rate. And the initial repayment on these is going to be deferred for 9 months. We're looking to really help these small businesses with cash flow issues, especially while we're still waiting for some of the other state and federal programs to come online. Businesses can still apply to the program for larger loans up to $250,000. Right now, this number actually changed. We're down to about $550,000 right now. We expect that will help 22 or 23 businesses. We have earmarked $200,000 for businesses in South Monterey County, and we will hold those funds available for those businesses through May 15th, and then we will open it up for any business in the county. The program is for businesses in Monterey County. We are really trying to target the small business with between 2 and 10 employees and annual revenues of less than $2 million. These are more guidelines than hard and fast rules, but we really want to hit those small businesses. We want to have businesses that have been in the community for at least a year, have some kind of a feasible plan for post-disruption recovery, and that you're current on your federal taxes. In the week that it's been open, we have had now 5 loans totaling $128,000. So there's still 550 or so left. Just a couple of other things. There are other business assistance programs being started locally. The El Pajaro Community Development Corporation is starting a program in the city of Salinas in partnership with the county. El Pajaro's phone number is shown. I'm not sure when that's going to be available, but you can certainly check with them. The Monterey Peninsula Chamber of Commerce has capitalized a program with grants from the Community Foundation and the City of Monterey, so that's really something that is targeted to the Monterey Peninsula, and they should be up and running in mid-May, and then you can contact the Chamber for more information. The county's loan program is administered by Cal Coastal, Rural Development Corporation. And if you have questions about the program or you want to apply, contact Cal Coastal directly. If you have questions about the program or have suggestions for how we might improve it, feel free to get a hold of me. And Maya, that's all I have.
Thank you, Darby. And then Mark, I think your mic is open. If you could mute your mic, that would be great. And then we'd
like to go to Lori Van Beber from Cal Coastal if she is on the line.
Can you hear me?
I sure can.
Oh, good. Oh, wow. Okay. Yes, this is Lori Van Beber. I'm with Cal Coastal, and we are administering the funds for the county. We, as Darby said, we've got 5 done. We're looking at deals from so far Salinas, Sand City, and Pacific Grove. We are getting these done in roughly 5 to 10 days. They the application is on our website, and it has been utilized by a very different company. And so definitely a needed resource. We currently have about 8 deals in the pipeline, and we still have the monies reserved, as Darby said, the $200,000 for South County, and I'm starting to see some deals come in from down south. We are this is a very targeted as far as small businesses. Darby kind of went through all of the requirements. What we tell people, because we had a gentleman that said, well, I have 11 employees, can I still? Those are guidelines, so we're trying to work within that, but we want to make sure that we're helping the most people we can. And one of the things we look for as we're reviewing these files is, do they have the capacity to repay? If they, things get going, and do they have the capacity to pay? And they're really for working capital loans, and they must explain how the funds would be used and why they were affected by the COVID-19. It's really, it's not to, buy somebody a new pickup truck. It's to help them to continue on their business. At that point, we also have, Cal Coastal is a lender. So we have a number of other programs that are, if someone doesn't quite fit in this program, we do have other programs, not disaster programs. So they take a little bit longer and that kind of thing.
Thank you, Lori, very much.
Sure. Now let's go to Chris Donnelly with our Workforce Investment Board, who's going to join us with some information on employee services. Chris, can you join us? Well, we'll try again. Him in just a minute. Let's look for Randy Ishii and see if he's on the line.
Good afternoon, Maya. Can you hear me by way of sound check?
Yes, I can. Thank you.
Very good. Well, good afternoon, Maya. Good afternoon, ladies and gentlemen. My name is Randy Ishii. I am the Resource Management Agency's Chief of Public Works. As you know, there are many miles of county roads and hundreds of bridges here in Monterey County. The Public Works Division of the Resource Management Agency is responsible for keeping the roads safe and drivable for our motoring public. And during this pandemic crisis, an issue of which we are in, we continue to soldier on with that mission. Roads and bridge services are deemed essential to keep the county road and bridge infrastructure safe and drivable by the public, regardless of rain or shine. Our regular hours have been adjusted, but we continue to have after hours, weekend call out services all available, and we have our standard mission that we are continuing on. We do have some adjustments. For example, we are limited to 1 person per vehicle, and that has been a slight impediment on some of our certain services, such as litter abatement and grounds services. And some staff are working remotely as much as possible. And of course, when we require special equipment or expertise, we contract those services out, and we continue to do that too today. For example, we recently completed a countywide safety striping program to refresh the centerline safety striping on numerous county roads. Of the two divisions that we have the maintenance division and the engineering division. Maintenance continues to work on a daily basis to provide services for our public, such as pothole patching, debris removal, mowing, and traffic control. As a very recent example, this week, the road crews were out on Washington Street in Castroville repairing damaged sections of the roadway and patching potholes. In other parts of the county, the mowing services where road crews will use their mower and mow the grasses that grow in the road shoulder and cause issues there. We continue to mow those, especially considering these late rains of which we've had. And of course, when there's debris on or nearby the roadway, when Public Works receives the call, the crew will mobilize out to address that issue. I mentioned the second branch that we have, and that's the engineering staff. The engineers and project managers continue to prepare design plans or are overseeing the construction projects of which we currently have in place. To name some of those, some of the road projects that are in design that are now out to bid include the River Road Overlay Project from Limekiln to Gonzales River Road. Another project is the River Road Overlay from State Route 68 to Las Palmas Parkway. And another project that's also gone out to bid is the Gloria Road, Iverson Road, and Johnson Canyon Road Reconstruction Project. These are projects that were Measure X campaign projects, and we are keeping good on our schedule and putting those out to bid for the construction contractors to bid on. And we anticipate going to construction in the late summer of this calendar year, 2020. There's other projects that are occurring throughout the county. For example, the Lockwood-San Lucas Bridge and on Halone Road, we have either bridge repair work or bridge guardrail repair work that's occurring, and we anticipate having those completed within this calendar year. We plan on some bridge replacement projects that were already part of our capital plan, and we continue to put out the bid for later this summer. One of those is the Nacimiento Lake Drive Bridge Replacement Project, which is down in the South County. And another project is the Monterey Bay Sanctuary Scenic Trail Bike and Pedestrian Bridge out in the Moss Landing region. And as I mentioned before, those are both going out to bid later this summer. And I want to conclude on the note that despite having planned capital projects which are part of our essential function, we also provide emergency repair services. One of the spots that has a repairer on it currently is San Juan Road near Dunbarton. There's a damaged culvert in that location, and crews and contractors are out there repairing that culvert. And another repair project includes the Carmel Valley Road Repair Project, which is scheduled to start in mid-May of this calendar year. So those are some of the services of which we have been providing and continue to provide for our public. And that concludes my presentation for today, and I'll hand it back over to you, Maya.
Thanks very much, Randy.
I'm going to try one more time to get Chris Donnelly on the line. And I have a feeling I can't unmute him and can't
Reach him. So we'll move on to questions now. If there are any questions, I've got one coming in from Chad, and I think this is for Dr. Moreno. This is regarding the models. Are the county's preparedness efforts based mostly or solely on the CHIME model projection? And have there been any models run beyond those already publicly released?
So it's hard to understand what you're saying. Can you ask again, please?
Sure, and I apologize. I've got reverb here I can't get rid of. This is a question on the CHIME model projections. Have there been any models run beyond those already publicly released?
Oh, I see what you're saying. So actually, the CHIME model turned out to be the most appropriate, well, of the models we looked at. looking at what type of data was being required to put into the models and the type of reports that are generated. The CHIME model is the best model that we for Monterey County. So that's the one that we've used. In terms of repeating the model, if we repeat the model now, we haven't really had that much of an increase in cases. So we wouldn't expect much in terms of different outcomes from the CHIME model. So we will be repeating it when our epidemiologists believe there's enough, the increase in cases is large enough that we might expect a different outcomes from the model.
So, May, if I could also chime in on that question, because I saw no pun intended with the CHIME model, but you know, as far as for planning purposes, which goes beyond just what Dr. Moreno has to do in the health office. We're trying to, as I said, stand up a lot of different resources, whether it's the the alternative care site and alternative housing sites, and we as we're trying to stand those up, yes, we're looking at what Dr. Moreno and his staff are doing with the models and recognizing the limitations of those models. But we're also looking at what other counties, states, and countries are experiencing, and how it's impacting them, and the potential for it impacting us here, either up or down in relation to what they're experiencing. And I think there's some examples here in California that we can look to say, okay, we have to be prepared. Obviously, the Bay Area is one example, and there have been higher and lower per capita numbers in the Bay Area in relation to what Monterey County is experiencing right now, as well as we can look to some of our closer neighbors, whether it's Santa Cruz and San Benito. For example, San Luis Obispo County and Tulare County have higher rates per capita than we do. Tulare County is almost identical as far as population size. Granted, it's not on the coast and has different mixes of industries, but their numbers are far higher than ours per capita. But there are others that are probably lower, and we have to take all that information and digest it and say, okay, what can we do here within the constraints that we might have as far as resources. We know we can't just stand up, every hotel room and commandeer every hotel room for our purposes to try and address this, as well as we can't try and stand up every possible large site that we might have our eyes set on. But we can look at what can we reasonably do within the resources that we have, and hoping that it would be great if we hit the nail right on the head and we said we had the exact number of beds, we prepared exactly for the perfect number of COVID positive patients or guests if they're not a patient in the hospital. That would be ideal, but we know that's not possible. So at this point, we're going to try and overestimate, probably by far. I hope it's by far. The risk is that it's not. And as I've said, we're going to try to make sure that we're over prepared rather than under prepared, recognizing the resources that we have and try to utilize as many as we have. And we get into coordination with the different industries that are out there, as I said, as well as the state and federal government, as far as what kind of resources they can help us with and what we can expect as to address the needs of our population.
Thank you, Charles. Dr. Moreno, this is for you. It's preliminary, but what would a face mask covering order contain or look like for the county? Unmute.
Did you say face mask?
Face mask or covering.
Covering, sorry. So the the face covering is okay. Let me back up. We need to remember that the hospitals and healthcare providers in Monterey County and other parts of the U.S. Have some personal protective equipment, including surgical masks and N95 respirators. but we still are very concerned that it's enough for now, might be enough for now, but when we get to the peak of the pandemic, they may go through that very quickly. And so we're doing everything we can to preserve our surgical masks and N95s now for our healthcare providers to use later. So the face coverings are not intended to be the surgical or procedure masks that one might see in a hospital being used by patients that are coughing or some of the staff. The face coverings can be made out of cloth and can be homemade or bought online or bought in the stores if they're available in stores. And they can tie in the back, or they can have elastic that goes around the ears, or they may not tie. They may not have ties. They may not have elastic, but they just be long enough that you can actually secure it using the piece of material itself in the back of the head and back. So that would include scarves, bandanas, for example. So it's really intended to just serve as a barrier over the nose and the mouth, so that when a person is out and they're out of their home in public, and there are certain situations where they're in areas where other people are at, then they cover, each person needs to cover their mouth and the nose, so that if they happen to be infectious while they're out and they cough or sneeze, they're much less likely to spread the water droplets through the air to people who are nearby who are breathing the same air.
Thank you, Dr. Moreno. Here's another question for you. What percentage of the tests for COVID-19 have been done for farm workers?
You need to unmute.
Okay.
Go ahead, Dr. Moreno.
Thanks. So what we know is that we know that we have about, to date, we have about 41 Monterey County residents that have identified themselves as working in the ag industry. So that makes up about 25% of all the cases at this time. And this would include anyone identifying as in the ag industries. So that could be farm workers, it could be people working in packing, in sheds, in transportation. They just identify themselves as in the ag business.
Thank you, Dr. Moreno. A question came in on hotels and motels. I will forward that to the EOC. Are there any questions from the group? That's all I have in chat.
Yes, I have a question.
Go ahead.
Go ahead. Hi, Adriana.
Hi, May and Dr. Moreno. I have a question. Thank you very much for clarifying that about the farm workers, but this is kind of related to the mask. Santa Cruz County signed an executive order started today, midnight, making it mandatory to wear masks in public places. Has the county signed a similar order? Not yet. Thank you.
Okay, thank you, Adriana. So I haven't signed a similar health officer order yet, but I'm working on one.
And Sarah, you have your hand up.
Yes, thank you, Maya. I wonder if Dr. Moreno and Charles, you might speak to the May 3rd end date on the current shelter-in-place order as that approaches. Has there been a determination made yet as to whether that will be honored or extended? And if not, when might there be a decision made, and when will the public be notified about what's next after that date?
All right, so, well, if you don't mind, Charles, I can start. So yes, there's an end date for the current shelter-in-place order. The current for May 3rd, the current shelter-in-place order is working. It is slowing down the spread of the virus, and decreasing, hopefully, based on what we've seen, will decrease the number of people who get sick all at the same time during the peak of this pandemic in Monterey County. So it is working, and also delaying infections among people who are at risk for dying of COVID-19. So are people over the age of 65 and people with vulnerable populations. So hopefully we can delay that most of those individuals from getting sick with COVID-19, which would prevent death, and hopefully long enough until we're we're past the peak and the transmission is really slowed down, or a bit better yet, we have a vaccine or possibly a treatment for people who are vulnerable to the virus who get sick. So because it's working, I'm intending on extending the order, and what we're working on right now is just working with Charles McKee, working with our epidemiologist, looking at the data and what we think it reflects, and then working with the state health officer, her team, and fellow health officers on the Central Coast and the Bay Area on where we think whether or not it's time to release some of the restrictions beyond essential services, whether it's time, and if it is time, where we as a group of public health officials think would provide the best maximum benefit to the social, emotional, and economic economy, of Monterey County and this region, but still minimize the amount of spread of COVID-19 in Monterey County.
Thank you, Dr. Moreno. Mark, do you have a question?
I do. I actually have a question for Randy at the Resource Agency, if he's still there.
I am here.
Okay. Hey, you were talking about road projects, and I just thought I'd ask this question. It comes to mind. What's the county's timeline on fixing San Juan grade between, I believe, Crazy Horse and the Summit, where it changes to San Benito County? The road is in terrible condition.
That is a very good question, and currently the Resource Management Agency is taking its capital improvement program through the CIP process. I'm unfortunately getting some reverberation back. I'm not sure which source might be coming from, but hopefully that abated. So on that note, we have a update to our pavement asset management program, which is the planned set of projects that we have that are in addition to the Measure X projects and current bridge projects of which we currently have. And those materials are available at one of our more recent Capital Improvement Committee meetings. In it, you'll find the priorities that have been laid out to us by using an analytic software program that many California counties use, and was pioneered by the Metropolitan Transportation Commission from the Bay Area. It's called Street Saver. It's industry standard software, and it recommends the various road priorities to us for our future years. I would encourage yourself and members of the public to look at that document available online to see where those road priorities fall. As I sit here today, I'm not able to tell you which year that San Juan grade road within those limits you mentioned are slated for repair, but I do know that there is a bridge over the Gavilan Creek from roughly the Crazy Horse Canyon intersection out to the San Benito County line that is being improved. It has some temporary repairs on it now, and we're working with the regulatory agencies to do a permanent repair of that bridge.
All right, thanks. I do have a question for Dr. Moreno. And this came in from a listener. They want to know, what constitutes a coronavirus recovery? Does someone have to be retested and show that they don't have the virus to be an official recovery? Does everyone do this, or are there just some people who just get better and aren't tested again?
So thank you. So there are two ways to identify someone who has been confirmed COVID-19 that they've recovered from the illness, according to the Centers for Disease Control and Prevention. So one way is to test someone with a PCR test looking for the virus. as they start to feel better. And if they have 2 tests at least 24 hours apart, then, and they're both negative, then that person is no longer considered infectious. However, there aren't enough tests in the United States for to implement at this time to implement that method of releasing someone from isolation. So the other recommendation which the CDC put out, which is to be used when there aren't sufficient tests available to test everyone at least to see if they've got 2 negative tests, is by symptoms. So that the guidance there states that if a person has been confirmed to have COVID-19, then they shall be in isolation during their infectious period. And then they can leave isolation when at least 7 days have passed since the onset of their first symptoms of COVID-19, and they've been afebrile for 72 hours and haven't needed to use fever-reducing medication to remain afebrile, and they've had improved respiratory symptoms of COVID-19. So if they meet those 3 criteria, then that person can leave isolation. That's the method that we're using here in Monterey County, again, because we don't have sufficient testing ability in Monterey County to use the other method. And so when people meet that criteria, they are considered recovered, and we would add them to the cumulative number of individuals that are considered recovered.
Thank you, Dr. Moreno.
Mark, do you have any other questions?
Okay, that is a no. Are there any other questions for our presenters?
I have a question. This is Sara Rubin speaking.
Go ahead.
One thing that I have asked about before is in circumstances where there is a confirmed case and the person may have been in public places based on their work or just their regular living activities, we're hearing that employers are notifying a workplace. You've indicated that there won't be any kind of PSA widely broadcast unless it would change, something about how people conduct themselves. I wonder if that hasn't been triggered yet, why not? I guess if somebody has been to a large department store, for example, or, how are people supposed to know if they might have been exposed? Is that happening through that nearly 1,000 person contact tracing? Is that enough of a way to get that message out widely to the people who could have come in contact with the infected person?
Yes, okay, thank you. So, so we're in a pandemic, and Monterey County is part of that pandemic. So the virus is spreading in the community. So right now it's not safe to leave your home during a pandemic. Anytime someone leaves their home, they're running the risk of being exposed to the virus or exposing someone else to the virus. So that's why we have so many, that shelter-in-place order and the social distancing requirement. So people who go out and keep 6 feet distance from one another, for example, that's intended to allow people to provide essential services or receive essential services. But the thing is, we still have, let me check here, almost 30% of cases that are reported to us are community acquired. That means the person doesn't remember ever being around anyone that had COVID symptoms. And when we look at our records, they weren't exposed to any of our confirmed cases. So almost 30% of these cases are from people getting it from somewhere and they don't know where they got it. So it could be a department store, for example, could be a park where they're walking, could be when they got their car repaired. So it's out there, it's everywhere, and it's every part of the county. So at this point, because anyone walking into a grocery store or department store could be exposed to COVID-19, what we're really focusing on now is trying to remind people that it is still risky to go out in public. Everyone needs to know that and follow all the social distancing recommendations when you go out. When we work with employers, we're really looking at those that were in closest contact and that typically are the coworkers because they're there for shifts or extended shifts. For example, they're working side by side with someone for extended periods of time. And so that's really what we're focusing on. The customers tend to be in there and have very brief encounters with anyone that might be infectious, and that's what we've been identifying when we talk to employers who have customers. And so we've continued to focus on individuals that spend more time with a sick employee, which tend to be the coworkers and management.
Sarah,
Sarah,
do
do
you
you
have any
have
other
a
questions?
question on that one? Okay.
I have a question. Excuse me. I have a question. Joan Maltese from KSBW for Dr. Moreno. Considering 16% of employment in Monterey County is in the ag, forestry, fishing, hunting industries, do you consider a 25% rate of cases in the ag industry to be something like disparate impact? And if so, are you doing any particular mitigations in the ag industry or doing any studies or any analysis of why such a large number of cases are in the ag industry?
So when I look at the number and percentage of cases that are confirmed to identify as working in the ag industry, I would say comparing that group to their proportion in the Monterey County population, I would say at this point we probably have enough numbers to say that they're overrepresented. And when you're in this case, when you're overrepresented among confirmed cases, that would be considered a disparity. And so what we're doing is, and then why is this happening? We know that in some of these cases, individuals are living, maybe spending quite a bit of time with, again, with coworkers, next to coworkers having to work in some proximity for extended periods of time, or living with large households, or in settings where other farm workers are living together to work here in Monterey County. So those are probably some of the reasons why we're seeing more cases, a disproportionately higher number of cases among those that work in agriculture. So what we're doing is, like we do with all our cases, is to identify who they were in close contact with and quarantine those individuals, and also to work with the employers to identify any employees that the worker didn't identify to us that the employer thought had been exposed, and working with the employer on quarantine measures. And I think if Charles is still there, he might want to comment on some of the other things that the health department and the county are doing, and working with partnering agencies and organizations to address the issue among farm workers.
Yeah, thank you, Doctor. Yeah, we are reaching out and working with the industry groups, the trade groups, as well as some of the individual agricultural companies. In addition, obviously working with the Monterey County Agricultural Commissioner in putting out the protocols that are kind of best practice protocols at this point, as well as making sure that they're aware of the different resources that would be available if any of their workers become positive, and making sure that the message is getting out about those resources to individuals in those industrial sectors, so that we know that many of workers that are may not be aware of the resources that are available if somebody were to get sick, and we want to make sure that message is getting out. And so we're coordinating with the industry leaders, the industry trade groups, the Growers Shippers Association, the Farm Bureau of Vintners and Growers Association, those kinds of entities, as well as the hospitals themselves, because they obviously are seeing people come in and have the need to refer them to an appropriate shelter site. So there's a multi-pronged approach, and also I will say that the state is also trying to assist, and we're coordinating with the state Office of Emergency Services and their Department of Social Services to try and see how they can assist in getting coordination within mainly the agriculture industry or other industries that also need to be we have to be watching at this point.
Thank you, Charles. We just have a couple of minutes left, and I'll hit some other questions. Dr. Moreno, what criteria are you using to determine whether and how the shelter-in-place
order is working?
Thank you. So what we're using at this time are epi curves that specifically look at sampling rates of virus. And so I apologize if I've said this several times, but I don't mind repeating it. So our epidemiologists look at, add up the total number of cases, and we look at, one measure we look at is how long does it take for the number of confirmed cases in a community, in a population, to double. An example will be going from 10 confirmed cases to 20 confirmed cases. So if it takes 2 days to go from 10 confirmed cases to 20 confirmed cases, and then another 2 days to go from 20 cases to 40 cases, that is a significant and rapid increase in cases. And that would indicate that the virus is spreading rapidly, and we'd be very much concerned if that happens, because at that rate, many people will become infected at the same time when we reach the peak of the pandemic. And so the shelter in place, the social distancing, and the other things, the school closures or learning from home, strategies that have been implemented are intended to slow down the spread of the virus. And so if we're successful, then it would take longer for the total number of cases to double. So rather than every 2 days, it would be better for all of us if it took maybe 4 days or 5 days or 6 days to go from 10 to 20, and then another 6 days to go from 20 to 40. That means that people are still getting sick, but it's happening over a slower period of time, which means when we get to a peak, hopefully the peak won't be as high. And also it buys us time for hospitals and healthcare providers to start to continue to try to build up their supply of personal protective equipment, their supply of ventilators, to renovate ventilators, refurbish ventilators, to make arrangements in the hospitals to be able to hospitalize more patients than they're licensed to hospitalize. And so there's very good reasons. And as I mentioned before, if someone is over 65 or vulnerable to COVID-19, if we can slow down the spread, there's a proportion of people who are vulnerable who will get sick, but they may get sick later on, or hopefully if they do get sick or they do get exposed, they might have actually received a vaccine before their first exposure. So many reasons why we want to do this. And so that's what we're using. And currently our epidemiologists are looking at the data and say that right now, or at least for the past month, the virus, the number of confirmed cases is doubling, but that period of time it takes to double is about 14 days. So all this work that we're all doing is reducing the number of confirmed cases. When I will acknowledge though, I'm still hopeful that we get more capacity to test for the virus. When we get more capacity in our hospitals to add to our the commercial lab capacity and our public health lab capacity, more of the people who are symptomatic, who are mildly symptomatic or asymptomatic getting tested would mean that we would be able to identify people who had COVID-19, but otherwise, under current circumstances, would not have been identified as a confirmed case. So the role of the epidemiologist at that time would be to do analysis to determine what is the actual increase in number of the doubling rate due to transmission of the virus and not just from increased testing. And then finally, one of the tools that we don't have yet, but would be very helpful, would be to have a seroprevalence test, which would be looking at antibody levels of the general population or of the population to identify who might have already been exposed to COVID-19. And in order to do that, we need money to do that type of work. We need tests that are validated by, ideally validated by the FDA, stating that when someone receives a test, a serology test or antibody test with this testing methodology, that if a test is positive, it's positive because they were exposed to COVID-19 and not positive because they were previously exposed to one of the many other coronaviruses that we've all been exposed to during our lifetimes. So we still have, the United States still has a lot of work to do and getting to a place where public health has more data that we can make that can guide our decisions.
Thank you, Dr. Moreno. And that ends our time today. We're over our hour. Questions that have come in, we will forward. Thanks for joining us today.